Now, following an announcement by the Minister of Health, Dr. Zweli Mkhize, the country's healthcare workers will not receive the Johnson & Johnson vaccine until regulators have concluded their investigation into possible links between the vaccine and blood clotting. Now, this comes after 6 women in the United States reported rare brain clots. The vaccine has already been administered to around 290,000 of South Africa's healthcare workers as part of the early access program known as the Sisonke Protocol. For a response on how healthcare workers will be affected by this, I'm joined by Sister Sibongiseni Delihlazo, who is a spokesperson for the Democratic Nursing Organization of South Africa, DENOSA, as well as Dr. Angelique Coetzee, who's chairperson of the South African Medical Association. A very good afternoon to both of you. Let me start with you, Sibongiseni. How many of the 290,000 plus of the healthcare workers who've been vaccinated are actually nurses?
Good afternoon to you, Thami. It's a brother here. Well, I think the department can assist with that. Of course, the information is not coming as forth as much as we think we should, because we got great interest in knowing exactly how many nurses, just as I think doctors also would have an interest in knowing as to how many doctors have, because those two are your what you call frontliners. And we do know that initially, when the rollout was beginning, there was a bit of unhappiness that it looked like your frontliners, the doctors and nurses, were not on the front line, obviously, because they are working, and it would appear that it's other healthcare workers, of course, that are taking advantage. And of course, if they do have time, they have every right to do so. So we always had a bit of a concern, because if you talk of the third wave that we are approaching, it is important and it is in our interest to ensure that the frontliners indeed are protected. But I think the Department of Health can assist with the specifics in terms of the numbers there.
But let's see if Dr. Coetzee perhaps has an idea of how many doctors actually have been vaccinated thus far as part of the Sisonke program. Dr. Angelique, do you have an idea of the numbers?
We have quite a good idea. It is around about not 60,000, around about 30,000 doctors that has been vaccinated so far. Remember, we don't have that many doctors in South Africa, or public sector. You know, the majority of them has been vaccinated by now, and they didn't expect, or they didn't got any side effects that we are now talking about that's got a significant impact on their vaccinations received.
You mentioned, Dr. Coetzee, that the side effects that the doctors experienced were not severe. They're not the blood clots that we're talking about. But what are the side effects that they did experience?
The most common side effects, we call it side effects, but it's actually adverse reactions, is where you haven't been injected. That's a sore muscle, sore arm, headaches, body aches and pains, and then some of them had a tiredness. It lasts for more or less, it can start fairly quick after you have been vaccinated, maybe within next 6 to 12 hours. It can start 24 hours later, but most of them were resolved around about day 4 and day 5. So it's nothing that was long-standing, and there was one anaphylactic, a person who had a severe anaphylactic reaction. They were treated, or that person has been treated, and again, as we have said, we haven't seen any serious side effects currently that we are aware of.
Well, please, I'm going to ask you, doctor, just to break down what an anaphylactic reaction is.
Anaphylactic reaction is where you get a vaccine or you get a medication, and then within about 20 minutes, between 15 and 20 minutes, you will have a serious breathing problem. You can have a swollen tongue. You can feel I can't get any air in. You can have a fell or the skin eruption. So that's more or less what you will see. But that's a serious type of adverse reaction, or that is a side effect. But again, we haven't seen it. As I've said, we are aware of one person. I suspect that we will see more on the Pfizer vaccination rollout program. as Pfizer's give more reactions, it's more, it causes more side effects or adverse reactions than Johnson & Johnson. Johnson & Johnson currently is quite a safe vaccine to use for the majority of people. Well, in South Africa, as I've said, we don't really have any stats of clotting.
When we come back, we're going to take a quick break, but when we come back, Sibongiseni, I want to find out from you the type of reactions that perhaps have been reported from the nursing fraternity. The doctor there mentioned adverse reactions such as sore arms, tiredness, and in extreme cases, breathing problems, swollen tongues, etc. I'd like to find out if you, as the nursing organization, have had any similar reports. Do stay with us. This is your daytime update right here on Newzroom Afrika, channel 405, keeping you abreast of all the day's breaking and developing stories. We'll be right back. A very good afternoon to you, and thank you for staying with us. This is your daytime update. We are currently in conversation with DENOSA as well as SAMA regarding reactions that some of the healthcare professionals may have experienced to the Johnson & Johnson vaccine. This in the wake of the reports that have come out of the United States as well as Europe of some finding themselves with adverse reactions such as blood clotting. Sibongiseni Delihlazo from DENOSA, just before the break, I asked you if perhaps you've had any sort of reports from the nurses regarding how their body has reacted to the Johnson & Johnson vaccine.
Well, the reports that we got from nurses is that, of course, the reaction is somewhat different from one to the other. Those who have been able to come to us, for instance, would let us know that around the arm where they got the shot, for instance, the pains that they would experience, and some redness that they also experience, and some swelling. And of course, around the body, the fever, tiredness, some headache as well, but nothing extraordinary and out of the expected symptoms, really. And for us, we are very thankful for that. And also that the government has made this decision is quite, I think it's out of care and, of course, out of extra precaution. We understand where they're coming from, and we hope that, of course, preparations are being made to ensure that should we perhaps have a similar case in the country, our response in terms of our healthcare workers to such would be up to standard and would be in real time so that we avoid any unnecessary delays further. At least we could be preparing now that we are in this period where we've paused the rollout.
The truth is, though, even though the rollout has been temporarily paused, there are hundreds of healthcare workers, nurses, who've already received the Johnson & Johnson vaccine. How does this bode as far as being open to continuing with taking the vaccine? Does this cause a bit of a backtracking, perhaps in willingness and eagerness to go ahead with vaccination?
Look, that is our fear. Of course, it has sent some mixed messages to our healthcare workers, particularly nurses. And of course, there are those who have just taken the jab not long, a couple of days, and looking at the profile of the 6 cases in the US, those who are obviously within that range in terms of time are the ones who are quite nervous. And we do hope that this does not really discourage many healthcare workers. And I think we need to really emphasize that even in the US, with the 6 cases, that have been recorded, there is no causal linkage between the vaccine and such blood clotting disorder. So it's a matter that's still under investigation. It may well happen that perhaps there is no causal linkage. Of course, I think we do know, for instance, looking at the ages of the women, if, for instance, you are taking oral contraceptives, from time to time, patients would experience, blood clotting. And if you take hormone therapy drugs, for instance, and even COVID-19 itself has proven that it does, you do develop blood clotting from time to time. But I think for us, our emphasis is to ensure that as a country, our monitoring system is tightened. Because if you detect it on time, medical intervention is there, and medical officers would obviously intervene and assist for as long as you detect it on time. And that is what we want to put a lot of focus on. And of course, we need to have many healthcare workers in order for them to be able to monitor very well the patients, and of course, including those that have gone through the jab at the moment.
Dr. Coetzee, looking at the United States and their figures, 6.6 million people have thus far been vaccinated. Of these 6.6, only 6 women have been found to have had adverse reactions of blood clotting. Do you think that perhaps there might be a bit of an overreaction here if you look at the ratio and the link between the vaccine and blood clotting?
Well, it's difficult if you ask a medical doctor, because if you look at the data, and again, it's less than 1 in a million that got giving you a history of blood clotting, possibly linked to Johnson & Johnson. For us, from a medical field, it's such an extraordinarily small number that if you to take that number and then want to say, no, we're not going to carry on, which by the way, the National Department of Health hasn't made that decision, that we're not going to carry on. This is only a temporary suspension, just to see what the data is saying. We own this to our people in this country. We owe it to them to say, listen, we are aware of what is happening in other countries. Let's just stand back. Let's just gather again. Let SAHPRA get us the information from Johnson & Johnson. I know SAHPRA is meeting with Johnson & Johnson later today as well. Get the information, look at the stats, and then come back and make a recommendation to the minister and on vaccines. So I think that's a correct way to do it. If you pick up something, you're not sure, then you stop. Temporarily, you stop. And get, as I've said, you get the information and then you carry on. We also need to understand that in South Africa, we've got our own problems. I'm going to say this again. The variant that is causing our COVID-19 disease is not the same that you will find in Europe or in America, although they are now starting to see these trends. Currently, with the data available for us in South Africa, it's only Johnson & Johnson, Pfizer, and Moderna that can help us being protected from this variant. From severe disease, we need to say that. So it's quite an effective vaccine. Also remember, AstraZeneca, there's a much bigger link with clots, with AstraZeneca. And what did England do? They said, okay, we acknowledge it's there. We need to look at our elderly population. Because if you get COVID-19, we know the stats are showing us that you are at a higher risk of dying. And again, remember, COVID-19 is a clotting disease. That's one of the biggest problems. Once if you start to clot when you have COVID-19, it's nearly a death sentence. If you are in ICU, it's extremely difficult to get patients out of that. So they then said, if you look at, we would rather give AstraZeneca to the elderly population and you young people who doesn't have such a high death rate. your death rate is very, very low when you get COVID-19. We will say, don't take that. So as long as we can identify the problem, if there's a problem with Johnson & Johnson, we make sure that the patients understand it when they sign the consent, and we make sure that we telling them the signs to watch out for, and if that happens, we can treat them. I can't see no reason at this stage why we should not continue with Johnson & Johnson. And I also want to say, myself, I'm not sure, maybe Sibongiseni also took it. I took the vaccine. I'm fine. Yes, I had my headaches. Don't forget about that. I did it. And I used Brufen, and it took it away. So, so far, we have not I had not got any calls from doctors today asking me, should we now stop taking it? Everyone is asking, when are we going to get the vaccine? So people are more worried.
And I wonder, let me bring you in here, Sibongiseni. Dr. Angelique said she had her jab. Did you have yours?
I'm the communications manager at DENOSA and the spokesperson. I wish I had to. I'm not the healthcare worker. If you know, of course, if you remember with phase 1, it's strictly healthcare workers that must be the beneficiaries. But of course, I'm waiting patiently for my turn. As soon as we get to the second phase, I will definitely be one of the first in the line. It's pity that I can't even on the first phase, but definitely we have not received any negative reports. Even if there were some, surely the nation would have been aware of it, and then, of course, proactive measures would have been taken. And I think it does send some mixed messages. And I think the reason behind that is because this information is coming to us quite raw and in real time. So, but I think we should give credit to our community of science. The transparency at which this has been handled is commendable, and I think it's one of its kind, and I think it's something that we should take great comfort in, even on each decision that we make going forward. It's something that we should take great comfort, and of course, as you know, we've got great scientists in South Africa, and who are the envy of the world.
And we'll leave it at that for this afternoon. Thank you so much to both of you, Sibongiseni Delihlazo from DENOSA, as well as Dr. Angelique Coetzee from SAMA, talking about the impact of the Johnson & Johnson vaccine on healthcare workers, as well as the impact of the temporary halting of the vaccination process. Both of them seeming quite confident that it will continue. Also a sentiment that was communicated by the minister himself a little bit earlier.